All right, Southwest Florida, welcome back to Lee Pitts Live. We're so thrilled to get her in here. DeLayna Horsford.
Happy to be here.
Good to get you here. A family medicine physician over there at Lee Community Healthcare in Dunbar. Let's bump you in.
Yes.
And you have some ties to Grenada.
I do.
Let's shout out Grenada.
I have to shout out Grenada, the Spice Island, yes, in the Caribbean. It is beautiful. That's actually where I went to medical school and where I met my husband as well.
Oh, okay. So you went to Grenada to medical school.
Yes.
And a lot of Grenadians come to America for Grenada.
That's very true.
My brother-in-law, Dr. Tony Hood, he came to America and he went to med school here in Texas.
Gotcha. Okay.
I think it'll be Texas Southern. And your husband is from Grenada. What's his name so we can have it documented so they can look him up?
His name is Michael Horsford.
Okay. Yes. And my wife is my brother-in-law's sister. They're all from Grenada.
They must be lovely people.
How small is this world?
Oh, too small, very small.
And I'm just from Birmingham.
Right. I grew up in Port Charlotte, so.
So they're looking at this now, getting a kick out of it. Well, that brings us to the moment. Yeah. We're so proud of you as a physician. Did all that hard work, med school, did all of the works. And the first time I saw you, you were doing coffee with a doctor or something like that. Tell us what that is.
Right. So we have an initiative through Lee Health called Barbershop Wellness. And we were getting together with the community in the barbershop to be in a nice, relaxed setting and talk about healthcare, talk about the things that maybe you don't want to bring up with your doctor because it's a little uncomfortable, and really focus on lifestyle related things. How can we help treat your conditions with things that are not just a pill and come with a lot of side effects and things like that. So that's a big passion of mine, is to be involved in the community and get to know the community so we can meet the needs of the community.
You said something there that really got my attention just now. How can we treat things without just giving you a lot of pills? As a doctor, we know, I guess you're going to speak to this, I'm just going to pontificate. We know that taking your meds properly is good for you when they're prescribed to you. But are you saying also you want to avoid having to take medicine, take pills, all more of a natural healing process? Go. Just kind of do you push the natural holistic approach to healing?
So what I realize, what we know, what research shows is that the way you take care of your body has a strong influence on the chronic conditions that you have. And so if you have high blood pressure, for example, that is a long-standing or chronic condition. And adjusting the way that you eat, maybe adding in some exercise, is all you need to take your blood pressure from high, I need medication, to a healthy level, no medication necessary. So if you fit in that category, I absolutely love going that route. There's no side effects to going for a walk in the afternoon or adding some fruits and vegetables to your daily routine for what you eat. However, if you're someone for whom those things are not quite enough, it may bring you down, but not to the level that's safe to prevent other complications. And yes, absolutely, there's a time for when the medicine is needed, and I would encourage you, if you're being prescribed medicine, that you should take it as prescribed.
Let's say you're taking a high blood pressure pill. And when you go to get your physical, your blood pressure is good because you're taking that pill to control it. How does one know when it's okay? And then they're doing all the other stuff in the interim to improve their diet and all of this. How does one know when they can get off that pill?
Excellent question. So that's where one of my favorite things to do actually is to de-prescribe. So this is something that should always be done under the care of a physician, of a medical professional, because you want to make sure that it's being done safely. Most of the time, if you are on, let's say, a high dose of a medicine, you start off by coming down to a lower dose and seeing if even at that lower dose, continuing the lifestyle things that you're doing to help keep things under control, you stay at a good level. And we can continue to lower the medicine and see if really all you truly need is just those lifestyle related things.
What do you say to people who have heard from their physician, hey, based on your ethnicity, your race, you generally have a certain higher blood pressure measurement than other people. So this is normal for you and your race, particularly African Americans?
What I would say to that is the content of melanin, which is the pigment, in your skin is not directly related to your blood pressure, right? So most of the time what we're talking about is not truly the genetics behind your ethnicity contributing to high blood pressure or any other chronic disease. Most of the time it is the culture surrounding your ethnicity. So some of the delicious food that I love growing up, my family is from the Caribbean, for example.
So-called soul food type stuff.
Soul food, there's lots of salt sometimes, and yes, it tastes great, but your body may not respond to it very well. Or lots of fried foods, lots of, or a plate that doesn't tend to have much fresh fruit and vegetables. These are the habits that anyone of any ethnicity, if you continue with those things, it can promote those chronic conditions to develop.
Salt is a no-no.
It is not a no-no, but it has to be done in moderation, or not having so much salt that it raises your blood sugar.
How often should people get their checkups with their doctors?
So I recommend at least annually, at the very least. And the reason is because even if everything it checks out every single time you go, it's perfect. In the event that things switch and your health is not quite what it was, we've got a track record of the last X number of years that you've been coming, and we can see where did things start to go a little bit awry. So it's really important that you don't wait until you start to feel symptoms to go to the doctor. Prevention is always better than cure, and as a family medicine physician, I cannot say that enough. It is better to prevent than to try to chase your tail trying to cure something that
so that copay, that little copay is worth it?
That copay is absolutely worth it. So if you consider, if we can prevent something from taking place, something that might cost you a massive hospital bill, something that might cost you regular daily medications that you pay for on a monthly basis, something that might cost you days off from work, when we can prevent that with a copay, which oftentimes is $0 or sometimes $15 once per year, absolutely, very worth it.
I said copay as though everybody has insurance. Everybody doesn't have insurance. Some people have a living from check to check or destitute. How can they continue to maintain their health?
That is a very good point, and this is actually where I love the job that I do, because my goal is to reach those kinds of people. So for the individuals that don't have insurance or that can't make it to a fancy doctor's office or what have you, over at the Lee Community Health Centers, I am going to be at the one over in Dunbar. We turn no one away. So if you need to be seen, we will absolutely see you. And what we do is we have a multidisciplinary approach, or different types of people in the office who can assist with things that are outside of just the medical part. So if we need to help with filling out things to get insurance, to get Medicare, Medicaid, those kinds of things, we're trying to address that as well, so that we can take care of the whole person.
The getting started, taking control of your health. You're sitting there on the sofa, is it ever too late to let me get started on something?
Yeah.
Give some people some ways to just get started.
Well, first, it is never too late to get started. Quick example, if you have been a smoker for the last 30 years, truth be told, every time you go to sleep at night and you're not smoking because you're asleep, your body is already trying to heal itself. But what we do is we wake up in the morning, have another cigarette, and the damage begins all over again. And that's the case for many chronic diseases. As long as you keep on whacking your leg on a table, you're going to continue to have pain and issues. But the moment you decide to stop, the moment you decide to make a change, however small, it's going to be a change toward health, and it's going to be a change you won't regret. You
mentioned the Lee Community Health Center. It's located here, not too far from this church, Mount Hermon, that we're taping. On Martin Luther King Boulevard, in the heart of the African American community here in the city of Fort Myers. That is an outstanding location for such a clinic, and has been renovated now. You got a new version of it. Being close to where the people are, healthcare, how vital is that?
So vital. If you cannot physically get to your doctor's office, I can make all the plans I want. I can involve all the social workers or insurance companies or whomever. But if you can't make it to the office, we've already failed. We can't get anywhere. So to be in the heart of the community where people who may need to bike to the office or walk to the office or Uber to the office can make it absolutely critical.
Full service walk-in clinic.
Yes, sir.
Where did you go to school? Give me a little background on you. You're sitting here all smart.
So I went to school in the Caribbean, in Grenada. Beautiful island.
Would that be the University of Grenada?
It's called St. George's University.
Okay.
And that is where I went to school. And the way that it works is you do 2 years on the island and 2 years back in the U.S. doing rotations. So that's what I did. After that, then there's residency, so family medicine residency, which I did right here in Lee County with the FSU Family Medicine Residency Program. So that was my connection back to this part of town, and I'm originally from Southwest Florida, so it's great to be back
Is
here.
that out in Immokalee when I passed that place? Is that the Family Residency Program?
Nope, not quite.
I see that out there.
Yeah, this one is actually over at Lee Health.
Okay.
Right at the Lee Memorial Hospital. The residency program we have is right there.
I think I see FSU written on it. That's
there,
what
yes.
There's several of them around here. I see. So you said early on in your conversation that when we talked about Lee Community Health Center and the African American community, or those who are disenfranchised in terms of getting health care, you said that's where your passion lies.
Yes.
People who don't have the money and all those types of things. You lit up when you said that. Is that one of the reasons that you decided to go into the field, or while you were in the field, you started to recognize that need and you kind of dedicated your life to educating people and being there as a servant?
So I've always had a heart for the underdog, so to speak. And so I knew that once I got into the field of medicine, that I wanted to be somewhere where I can serve underserved communities. But really, it wasn't until being involved that I saw the gravity of the need, and how disconnected you can be when you primarily work in areas with people that have access to everything that they need. And sometimes other communities sort of get left behind and are kind of unseen and forgotten. And I wanted to make sure that those communities are seen and are not forgotten and get the care that they need. You at Lee Community Health Center now in Dunbar.
That is a part of the Lee Health system. So
Yes.
when we're talking to you, we're still talking to a product or a person who is involved in the wonderful Lee Health system that has access to all those other forms of healthcare and specialists to provide additional care
Yes.
to the people who visit the clinic.
Yes, exactly. All a part of Lee Health, and there are branches in many other areas. There's the Lee community here in Dunbar. We've got one over in North Fort Myers as well. Just a quick Google search and you can find the nearest one by you.
Well, Doc, it's been a pleasure having you on the show.
It has been a pleasure being here.
Look forward to getting you back in the future.
Likewise, likewise.
Okay, so let me bump you out.
All right.
As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like this good doctor who are doing it. And Miami may have the oranges, but Lee Community Health Clinic of Dunbar has got the
juice.
Yes. We'll see you.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello, everybody. This is Lee. I'm so glad that you watched that particular show. And if you enjoyed that show, we got other shows like that. Just subscribe to our YouTube channel. Watch Lee Pitts Live on demand anytime. And also hit us up on all our social media platforms. Just type in Lee Pitts Live, and there you go.